I grew up in a broken home. One of my parents struggled with addictive behavior. And so I had a very parentified childhood, right? My trauma stems from things that I didn't have, which was a loving, nurturing environment. I remember being a little girl and feeling very overwhelmed, alone. I always knew that I wanted to work with people and helping them to never feel the way that I had felt. And it's not until recently when we put the Barbie doll head back on the doll that I feel like I can just be present.
I think a lot of what we see are unhealed wounds from childhood, this
Absolutely.
mental injury, this emotional injury, but the
Mhm.
mental health complex is only designed to look for the illness or the disorder. Today, I'm honored to welcome Jessica Parente, an ANCC board certified psychiatric mental health nurse practitioner. She's a CPT and ICF accredited somatic trauma informed coach and a level 4 Brainspotting practitioner. She's also the best-selling author. But beyond her credentials, Jessica is someone who has walked the path of healing herself, and after experiencing some deep personal struggles, including grief, trauma, and narcissistic abuse, she now dedicates her work to helping others break generational cycles and reclaim their own lives. And personally, I myself have been working with Jessica, doing some brain spotting with her, just to work on that modality, to check it out for myself, to see how it works, as I've considered getting trained in it myself. And it has been really, really very impactful. So in this journey today, in this particular episode, we're going to explore her lived experience, the impact of trauma on her nervous system, and how we can move from survival to true healing, or like I like to say, from survive to thrive. So let's get started with Jessica Parente. Guys, welcome Jess Parente, the founder of It Ends With You, LLC. Hey, Jess, how are you today?
Hi, Stacy. I'm so excited to be here and to have a chat with you.
Yeah, I'm so happy to have you here. And you and I met through Kira, which is great
Yep.
because I see Kira as a fantastic resource, as a
Yes.
peer in this trauma trained space. She
Yes.
really is so incredible. And then I started working with you, and you
Mhm.
became my practitioner because I'm so curious about brain spotting. It's
Yes.
something I've heard about for a long time. And as I'm gazing over into the corner here, I am I've always watched where my clients' eyes go when they're
Oh,
talking and when they're processing, and I know that there's something there about what's going on
yes.
inside the brain. And knowing me, I'll probably get trained in that modality sometime in the next year. I just signed up for a new course though, and it's not brain spotting. I'm
Mhm.
going to do Janina Fisher's TIST
Oh, wonderful.
training. So I've been wanting to do that, and the timing was right.
Yep.
So I'm doing that because she's amazing. But I will get to the brain spotting, and we will talk about our work together because it's been so
Mhm.
incredible. But, all of us come into this from
Mhm.
our own point of view, our own reasoning. So your story is deeply personal. What led you to this work, and
Mhm.
how did your own experiences shape your approach to healing?
Ooh, right. That's a loaded question. So I think that to give the abridged version, I had a very difficult childhood for reasons that I go into in some of my other podcast interviews and in my personal chapter, Lather, Rinse, Repeat Until You Don't, in a collaboration book. But, I grew up in a broken home. One of my parents struggled with addictive behavior. And so I had a very parentified childhood. It's not so much the things necessarily that did happen to me, which a lot did happen to me, but there were a lot of things, right? My trauma stems from things that I didn't have, which was a loving, nurturing environment. I remember being a little girl and feeling very overwhelmed, alone. I was highly perfectionistic, highly overachieving because school and dance were and outlets where I could feel seen and feel heard. So, from an extremely young age, I always knew that I wanted to work with people and helping them to never feel the way that I had felt. And I was initially driven to work with children, but because of all the courses of the events of my life, it just had led me in a different direction. And I still have, I don't not work with children, but I don't specialize in children. But I just remember being a child thinking I never wanted another child to ever feel that way. And that just was the catalyst to the very long walk it took me to getting to sitting in front of you right now.
I was so fascinated when you and I first met, and I found out that you were actually trained as a board certified psychiatric mental health nurse practitioner. What got you into that space initially? I mean, obviously,
Whew.
your your lived experience had some sort of influence on it, but that is a major career to be going towards. Can you tell us a little bit about that?
So going back to the child, right, that wanted to help other children, I think I was probably like 10 or 11. And we had this assignment at school, right? And what do you want to be when you grow up? And my answer to that was I wanted to be a child psychiatrist. How I even knew what the fuck that was at, 10, 11, whatever years old. So I had always, the foundation was there, right, from my
Mhm.
own pain and from my own loneliness. And so how that the walk that I took with that is I wanted to, when I got out of high school, I wanted to go to medical school, quickly found out that that was not in the cards for me. So actually, how I got to where I was through a lot of perceived failure, which was just different avenues in my life, wanting to take different avenues. So when I graduated, from the University of Pittsburgh. I worked in mental health at the bachelor's level, which is some of the most horrible and trying jobs that you can have. I worked in a partial hospital. I worked in a specialized school for autistic children, and you're not making any money with a ton and ton of debt. So I knew that I needed to do something else because I could not survive working 3 jobs like that for the rest of my life, though I was getting access to what it was like to be, quote, at the bottom of the barrel in our mental health treatment in this country. And so after I worked in that field for a few years, I was extremely burnout. And this was all while still going through my own trauma, still being in a complete fight or flight response nonstop, and a lot of drinking to numb out to counterbalance that. And so I knew the next step was I have to do something different. I applied to be a physician's assistant for probably 2 to 3 years, never got in. And I was like, okay, what is the next step here? And one of my best friends, he was dating a girl who was a nurse and went to this program nearby that did some medical mission work. And she really loved the program. And I had never considered nursing because I think when you grow up, quote, smart, there was something about like being a nurse that I feel like was talked negatively about, right? Well, you're smart enough to be the doctor. Why would you be the nurse? And so that was a lot of like false programming that got put
Right.
in my head because nurses are the heart of healthcare. So I went back to nursing school, absolutely loved it. I ended up working with children with I didn't want to do mental health nursing because I had done my like practicum, my clinical experience there, and it was just very, very depressing. A lot of just handing out pills across like a closed screen. And that's not what I wanted to do. I didn't feel like that was really honing in on my personalization skills and or my nursing skills. So I actually ended up working with children with cancer. And I felt like that was a great bridge for
Mm.
what I felt like I excelled at. And I did that for about 5 or 6 years. I love it. I miss it sometimes. And then out of that, the psych nurse practitioner thing, being a nurse practitioner, you can specialize, and psych is one of them. And so it was almost like this avenue where psych nurse practitioners are trained similarly, right? More med management like psychiatrists are. But I had all this other personal experience in my own therapy that I knew that no matter how they trained me, that I could bring a more holistic perspective just because of my own life experiences and my own healing. And that's a very long answer to a lot of
It's not
failure,
a
a lot of things that took me to where, I ended up.
But I think it's all important, and I wanna set that groundwork because of the conversation we're gonna have, that you've gone through serious extensive training, and you've been in the psychiatric space, and I
Yes.
think that that's a really unique,
Mhm.
quality. And I guess before we even get into the rest of it, the thing that's actually in my head is, now that you're more on this holistic side of
Mhm.
healing, but you were, and I shouldn't say you were. I'm going to ask you if you were. When you were trained as a nurse practitioner, was the goal there to really pathologize, diagnose, and treat? Which
Mhm.
would be very, the kind of work you and I do is what I'm going to call non-pathologizing. So for
Right.
people that don't understand what that means, well, I can explain it, but I want you to explain it. Explain the difference between a pathologizing situation and a non-pathologizing, because I think it's important. People don't know the difference.
Oh, well, I'm gonna answer it the way that I'm interpreting your question, and then you can piggyback
Yeah,
how
yeah.
you really want to answer it. Pathologizing to me is strategically kind of looking for a list of symptoms that are in the DSM that are fitting a set of criteria that says you have this or you have that, or it could be this or that or this and that. Right. So it's kind of looking at these symptoms or manifestations as a way to categorize them and then using that information to submit to insurance so you get reimbursement. It will justify what medications, if I'm choosing to put a client on medications, which ones that I am prescribing XYZ. Whereas a non-pathologizing approach to me is I just see the person for who they are and what they've been through and seeing them where their nervous system is at and telling them that there's nothing wrong with them because their body is having a reaction to their environment, to a situation. They're stuck in a trauma response, where a lot of the times my clients will ask me, well, what do you think my diagnosis is? And I'm like, I don't really care what your
100%.
diagnosis is, right? I'm treating, if I'm going to give a medication, I'm aiming to hit certain receptors that I know are involved in XYZ. And to be really fair, I don't use a lot of meds anymore. And anything that I do are very like as needed, things that are non addictive, low dose SSRIs, things that are very safe
Yeah.
with the goal of hopefully getting them off in the end. But I think why I ended up, and if I'm thinking about my higher purpose in life, why my path went the way that it was being trained as a doctor and sometimes even and this is no offense to doctors or physician's assistants, but they can be very book oriented and very kind of closed off to the more, let's say, magical or spiritual or things that you can't really explain, right? They're stuck in the more of the explaining and needing to
Yeah.
explain. Whereas nursing is really mind, body, emotion, spirit. It is a holistic approach to caring for a person. So I think that that's why I ended up being drawn to that and the other things didn't work out. But
I
to
love
get back to
that.
pathology, non-pathology, I don't know if I
Your
went the
explanation is the same as mine, and I almost look. There are certain things. Okay, so let's back it up. And I've shared this on the podcast before, but I never know who's new. So we'll
Mhm,
just do a little quick primer. Like in the what I'm going to call the industrial complex of mental health, right? So the
mhm,
system of mental health, there's a system. So, you're not feeling mentally well, you might end up going to a therapist because that's what's likely going to be recommended to you by a medical doctor.
mhm,
That therapist might say, "Hey, I think maybe you could utilize some meds." They
mhm.
can't prescribe meds. This is when you're going to a psychiatrist. Okay.
Right,
So a
or a
psychiatrist
nurse practitioner
or a
now.
nurse
Right,
practitioner, but somebody in psychiatry,
right.
they have the ability
Mhm,
to prescribe meds
mhm,
for something they consider be a psychiatric condition. The psychiatric condition has to come from the DSM 5. The DSM 5 is the Diagnostic Statistics Manual. It's in its fifth
mhm,
rendition. Similar, I didn't know that you used to work with the autistic population. I worked with the autistic population as a speech therapist in
mhm,
the early 90s. And that's when I first heard about the DSM. And I think it was in its third rendition or its fourth rendition then.
mhm.
So this is a book of diagnoses, and this
Right,
is primarily what is used by therapists and psychiatrists in order to diagnose and treat. In
right,
order for them to get paid by insurance, they must give a
right.
diagnosis from this book.
Mhm,
So here's the challenge when we get into this mental health, more holistic approach,
mhm.
is that not everything's in the book that
No,
should be in the book. And
no.
two glaring issues, two glaring things that are not in the book are complex PTSD and
Right.
developmental trauma disorder. And there are other books used around the world
Mhm.
And those conditions are in those books.
Right.
So within the United States system, that is not there. However, it would explain a lot of what we're seeing. So a lot of the diagnoses that are in the book are an enough alignment with what would have been complex PTSD, because there's so much lap over
Yes.
that they end up then getting diagnosed with that. And what
Right.
breaks my heart is I'm not saying that they're not showing this way. So, like ADHD is a perfect example. There's a complete overlap between ADHD and what I'm going to say is quote unquote the symptoms of complex PTSD.
Yep. And sometimes it's both.
And sometimes it's both.
Mm-hmm.
But if we're negating the complex PTSD
Yes.
part and we're only treating what we're able to diagnose because of the way the system's set up, we're
Right.
missing a whole aspect of the kid,
Right.
right? Or the adult. So, you know, I think you described it well. It's something I always want my clients to just be mindful of and aware of, because
Mm-hmm.
we've been taught to ask for what do I have and what's my diagnosis and how can you fix me and how can you fix this so I can feel better.
Mm-hmm.
And I had one of my mentors, Achara Tarfa, on my podcast a few months ago, and we talked about the difference between mental illness and mental injury. And
Mm-hmm.
to your point, I think a lot of what we see are unhealed wounds from childhood, this
Absolutely.
mental injury, this emotional injury, but the
Mm-hmm.
mental health complex is only designed to look for the illness or the disorder.
Yes.
Right. And so that's the difference, guys. When we're looking to pathologize, we're looking to give a diagnosis.
Mm-hmm.
And when we're non pathologizing, we're seeing exactly as just said, this person as having lived a series of experiences that are still impacting them.
Right.
We can approach it differently. And maybe medication is a part of that approach. And
Mm-hmm.
maybe it's not. It just depends on where the person is.
Yep.
But there are other ways to be seen, and there's other healing modalities just than going to a therapist and just going to a psychiatrist.
Absolutely.
So, all of that, one of the things that I know that you explained to me, that you just talked about some of your adaptations, if you were, to
Mm-hmm.
your own childhood as being perfectionism and parentifying and all these things. But I also know that you spend some time talking about functional freeze. And
Mm-hmm.
I think we hear people talk about like high functioning anxiety,
Mm-hmm.
but we don't hear a lot about functional freeze, which I really relate to both. So I'm
Mm-hmm.
wondering if you can kind of describe what that means and how did you start to begin to shift out of it?
So obviously, I can only speak from my own personal experience. So all of these things are my own definitions and how I can understand myself and when I'm going back into those patterns. So freeze state. I know that Stacy understands, and some of your listeners may understand polyvagal theory and have looked into that. So, how I look at functional freeze is this space in between being in a sympathetic, a fight or flight response, while also simultaneously being in a dorsal vagal or freeze response. And how that manifests for me is I was highly dissociated, and not dissociated in I'm on the outside of my body looking in, dissociated in that I wasn't even connected to my body. So on the outside, I was doing all of, quote, the right things. I had a job, I was going to work, I had tons of friends, I was going out and socializing, and I was staying on top of my bills, but I was going through the motions. So how, when I talk to my clients about it, I say we become almost like this. If we're a doll, like we're a Barbie doll, the head pops off the body and we're just kind of floating through life, doing the shit that we need to do. But I was not connected to myself. It's not that I wasn't having emotions. I was just going through the motions to either not experience the deeper emotions or to find ways to almost feel like I was doing something, right? I was being productive. I was being, a good member of society. And I think that, when I stand on my conspiracy theory soapbox, a lot of capitalism and how we live in America likes us to be in a functional freeze state. It likes us to be disconnected from our bodies, but still going through the motions and doing the things that we're supposed to be doing. And when that eventually crashed and burned, because I had burnt out a million times, in just through my 20s, through my teen years, through my 20s. And then when I really crashed and burned through my mid 30s and I found somatic work, I'd been doing therapy for 15 years and I didn't even realize that the shit that I was doing was just a purely sympathetic response. I'm doing all of that activation and energy inside of me, the racing thoughts, the perfectionism, the little OCD quirks that I have, the needing to constantly stay busy, the over explaining, but then also at the same time, not being connected to my instinct, not allowing emotions to even surface because I was so disconnected from allowing myself to just experience anything other than the doing. And then I would crash and burn into the freeze response and be super depressed, and I would be numbed out, and I would be finding ways to either numb out further, or I would go back into that sympathetic response of doing. So there was a pattern of this through my life. And it's not until recently when we put the Barbie doll head back on the doll that I feel like I can just be present. I can sit and do nothing and feel just as good about myself as when I'm checking 1,000 things off of the never ending to do list. And
Mm,
I'm really experiencing life now. And it's not to say that I don't go back into that functional freeze. That's a really strong pathway for me. That's what, when I was a child, right? Like, if you have, or you grow up in an environment where you don't, where you're sensing, right, that your wants and needs might not be met. And a child is like, as human beings, we're more than house plants. We need more, like this whole, like, well, you had a roof over your head and you were fed and blah, like, who gives a fuck? Like, we need more than that. Children need more than that to feel safe and to also develop a sense of self.
right.
And when a child picks up in the environment that that is not going to happen, your body's natural response is just to check out, so to dissociate. And there's so many of us that go through life dissociated, not, again, not in the way that is pathologized and that they talk about, but there's this
Right.
natural, dissociation is a great coping mechanism and something that our body does naturally. But
But
when you
it's
are,
a survival technique.
exactly. And
And
when
this
I,
makes me crazy when people are like, I have dissociative identity disorder, or I'm
well, you
like,
just
but
have a lot of protector parts.
right. Or maybe you just learned how to survive by
Yes.
going into this functional freeze mode,
Yes.
right?
How human beings are so highly adaptive. So, two of the strongest protector parts for children are dissociation and people pleasing,
That's
because children
100%.
want to be helpful.
Well,
So,
and
that's,
think about that,
yeah,
and I was just mentioning to you before, I'm going into another training, which I haven't yet told my
mhm.
husband about. He's going to be like, you are insane.
So, you have a little bit of a training junkie part, which is
I
just
do.
like,
But you know what? It's like
I love to learn.
insatiable. Like I see people like I'm gonna get trained by Janina Fisher now
Yeah,
because when I read, and I haven't even ever finished the book, but just from what I read, I was like, I need to just be trained by her. It was
sure.
Healing the Fragments of Self.
Yeah,
And
you're drawn to it, right, energetically, which is what I wasn't doing
energetically,
before. Now I have that. I feel that.
but it's all about what we're talking about, which is yes, you develop these parts of yourself in survival, but these are human natural animalistic instincts to
Yes,
adaptation to our
yes.
environment. And it, to me, it's just so crystal clear obvious.
Mhm,
However, I want to point out two things. Number one, gosh, our stories are so similar. I'm
mhm,
older than you, but I spent 20 years in the sympathetic state. So I want people to, I've studied so much, I've had to come up with like little hacks to try to remember shit.
yeah,
Right. So I'm going to give this hack to people. We hear often about sympathetic and parasympathetic.
mhm,
Sympathetic is your fight or flight. You have to take action. Your body feels it has to be in action. Your body feels like it has to be in motion. Okay. Parasympathetic is what we call rest and digest. It's
mhm,
when the fight or flight is not activated. I
right,
always think of parasympathetic as when you're at peace.
yes.
Okay. PP. That's the way I had to remember it. Parasympathetic starts with a P. P starts with a P. When you're at
Mhm,
rest and digest, you're in peace. So whoever needed that little hack, you've got it. But I was in this fight or flight response for
mhm,
obvious reasons from the
mhm,
age of like 12, 13, until like 33. And
Yeah.
I don't know if you were like this. Like, I knew I had this activation in my nervous system. I always felt like I had a flutter in my chest. I always felt like I couldn't take a deep breath. My stomach
Mhm,
was always a mess. I was always
mhm,
severely underweight because I couldn't digest well. Like, I had all these issues. However, in the 80s and 90s, nobody ever talked about anxiety. We
right.
could maybe talk a little bit about stress, but it really wasn't a part of our vernacular. I
Mhm,
could see,
mhm,
especially in college, people were unburdened by what was burdening me because
mhm,
I had this high sensitivity and this high activation in my nervous system 24/7, which
right.
then initially then goes to your mind, because then you're
Mhm.
like, now you're right, your brain
You're
is
on the hamster wheel.
racing, you're on
Yep,
the hamster wheel, you can't get off.
right.
For me, I was frustrated because I had so much gratitude. I didn't I wasn't a sad person. I wasn't
Mhm,
malazed. I wasn't melancholy. But at
mhm.
some point, my body could not sustain
Yeah.
that level of activation. And then I dropped and flopped into what Jess just described as this dorsal vagal space, which
Mhm.
looks like quote unquote depression. I was
Right.
fatigued. I
Mhm.
was lethargic. I was unmotivated. I could
Can't make a
procrastinate,
decision. Yep. Brain
couldn't
fog.
think,
Mhm.
I couldn't even make a cup of coffee. Like, I would
Yep.
stand in front of the coffee maker and be like, "Do I want creamer? Do I not want creamer?" Like,
Mhm.
you don't recognize yourself. And
Right.
so, I think what I've learned studying polyvagal theory is that, I was in this go, 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 not intentionally, not consciously, because I was actually not a perfectionist.
Mhm.
I was the antithesis of your traditional people pleasing.
Mhm.
Okay. I was always more of a fighter,
Mhm.
not so much a like, let me tell you what you want to hear kind of person.
Right.
But if I have to really think about it, of course, I people pleased in certain scenarios where I did not feel safe, seen, or understood,
Absolutely, and that's
right?
a
Because we
part of
just naturally
development
do
as
it.
well. Yeah, we want to be included in the group.
Yeah. And I think it's important to understand too for people that, we talk about children tend to go to freeze and fawn. So fawning
Mhm.
is that people pleasing. But if
Mhm.
you think about it, say a child is either in a situation where something's happening to them,
Mhm.
or they're in a situation like you described where it's not what happened, it's what didn't happen.
Right.
Okay. But we can't really fight our way to
No,
safety in that situation. And where are we going? We
we
can't
can't
just get up
fight.
and
Yeah,
flee. So,
exactly.
our most natural response is to shut down because the emotional pain of what's happening is so significant. We just kind of disconnect.
And you don't understand it as a child.
No,
And
it's just
you
it's
barely
almost,
understand it as an adult because we're all so repressed.
but it's like a covert coping strategy. You don't
Oh,
know you're doing it. You just kind
no.
of get smaller, you
And you don't
know?
know it's not when you get to be an adult, you don't know it's not, quote, "normal" until you're comparing to peers and
That's right.
seeing, "Oh, like, well, I'm having panic about this, but I don't like, my friend over here is handling that test or scenario or situation just fine." And the comparison culture is really one that's dangerous as well, but it can also help you to understand that what you're doing or the things that the cycles that you're kind of stuck in are not healthy, even if they are, quote, normal to you.
Well, I always say it might be normal for you or for your family unit or for your
Right.
environment or for your
Mhm.
culture or for your neighborhood or for your block or for
Yep.
what it is, but it may not be normal for the human body's nervous system.
Yes. Yes. Or it may not
Is-
be healthy for you anymore.
Right. Right.
Mhm.
Okay. So I love the psychoeducation laying the framework.
Yeah,
Okay.
sure.
So I really want to talk about brain spotting because I've
Mhm.
never had anybody on the
Mhm.
podcast that can describe brain spotting, is a practitioner of brain spotting. I've been so curious about it. I've seen this word all over the place, gosh, since 2020 when I started my practice. I didn't know what it was.
Mhm.
I knew it could be very good for trauma
Mhm.
processing. So, can you describe what brain spotting is and how it plays a role in everything we're talking about here?
Sure. So, brain spotting is a deeply effective and healing somatic is just a fancy word for body, somatic healing modality that uses eye positioning. So, where your eyes are looking to help release trapped trauma, emotions, etc., cycles that are going on within your body. And so, brain spotting was discovered. I'm not going to necessarily say developed because in the trainings that I continue to do, I feel like David Grand, who discovered brain spotting, wants to keep it very fluid, which is super different from how in the Western medicine world we like things kind of structured, right? In the right, wrong way to do things. And there is no wrong way to do brain spotting. So as he discovered it he's an EMDR practitioner, which I am not, he noticed, right? He was really sitting in attunement is a big piece of brain spotting, which is really sitting with your client and allowing that space for them to process things and to feel safe in their emotions. And as he was attuning to someone that he was working with, he noticed that their eyes kept going to the same position in the room when they were talking about something that they were really struggling with. And as he had them, he just directed them to hold that position and see how they felt in their body. Again, it's connecting what's going on in the mind and how we're kind of stuck in these verbal cycles or things that we know that are troubling for us, but we don't know how to get unstuck from them. So she was talking about something that was really troubling to her, and he had her hold the eye position and just notice how she felt in her body. And there was this, like, not everybody has this when they process, but she had this big release of emotion and the body experiencing a trauma response that had not been completed, because many times we interrupt it with our things like perfectionism, control, people pleasing. And there's a slew of survival mechanisms, dissociation, right? That I know personally for me. So when he allowed her to just hold that eye position and the story to be completed, it was almost like her subconscious was taking her on this beautiful walk of things that she had experienced in childhood or things that she had experienced that were along the same theme line of what she was talking about that she was struggling with, which was probably some sort of lack of control, right? And as he allowed her to do this and connecting to the body and allowing that trauma response to complete itself, it was within a few sessions that she came back and she just didn't have the body reaction to the thing that was bugging her before.
Uh, This, first of all, great explanation. Thank you. And I think,
Really
a kind
complex because it's hard to explain something that
I
unless you experience it is really inexplicable. It's almost like magic. You don't
Well,
understand.
it is and it isn't, right? Because we know that there's something about the ocular nerve connected in the
Yes.
brain, and we don't need to
Yes.
get into the science about it. But I
Yep.
think it's important the way you wrapped it up, because what I wrote down here as my question for you is, why is somatic helpful? But I want to peel back and come
Mhm.
back from that for a second. You just said it, and this is where I think, EMDR is really helpful too,
Absolutely.
is that when people come to you, when they come to me,
Mhm.
so much of what has them feeling so stuck is a physiological response in the body,
That's where it all starts.
right? So they're coming
Mhm.
and saying, I'm riddled with anxiety. I'm drowning in anxiety. I'm suffering
Mhm.
with anxiety. I'm,
Mhm.
taken over by anxiety. And I relate to that because that was me. And I
Mhm.
remember I had been in and out of therapy for 20 years,
Mhm.
still riddled with
Mhm.
this overwhelming, debilitating anxiety. And
Yeah.
the anxiety was in my throat, in my chest, in my
Mhm.
stomach.
Yep.
Not so much in my head. Like, I'm not one that has like ruminating thoughts. It was all
Right.
somatic for me. But I didn't understand that. And I had always been told by psychiatrists, by therapists, that I had anxiety and I had
Yep.
generalized anxiety disorder. And this was just my fate. And
This is just it.
a lot of
Yep.
other people had it in my family, and so I
Yeah,
just
so it makes
accepted what it was, just like any other diagnosis.
sure.
But even with the meds and
Mhm.
even with the therapy,
Mhm.
I still had anxiety. And
Yep.
so I had this, what I always say is my second nervous breakdown. On my first one in my early 30s, my second one in my early 40s, all circumstantial, right? All things that left me feeling further unsafe and insecure.
Or breathing
And
in those things that had not been
everything just blew
opportunities.
up.
Yes.
And I remember somebody had given me the business card of like clinical hypnotherapist, and I had it
Yeah.
for 2 years.
Mhm.
And I finally called her after 2 years and I said to her, there's a disconnect because
Mhm.
I'm walking every single day with such an intentionally deep gratitude practice,
Mhm.
and it's not connecting to my body. My body's not responding.
Yeah, 'cause it's in 2
And
different areas of the brain.
even she couldn't really explain that, but the hypnosis helped. So
Yeah.
I stuck with it. And this is part
Mhm.
of the reason why I got trained in hypnosis myself. But it's important for people that are listening to really attune, to your point,
Mhm.
to their own bodies. And when they're telling themselves the message, I suffer from anxiety, or I have anxiety, or my anxiety, I would
Mhm.
like for you to do what I do when my clients come in. I sit them down and they say they have this, and I say, how do you know? I said,
Yeah.
I'm not questioning you. I
No.
believe you, but I want you to be able to explain it to me how
Yes.
it's impacting you. And they
Yes.
all say the same thing. It's something from the neck to the gut,
Uh-huh.
right? So
Yeah.
what they're describing is a physiological response. And I
Mhm.
try to I bring down my brain. I'm always looking for a 3D model of a vagus nerve, which I've yet to
Mhm.
find. And I
Mhm.
explain to them biologically what's happening inside their autonomic nervous system, so they
Mhm.
can understand their body's responding to either a real or perceived threat.
Yeah,
So
there's
what I
cues in
like
the environment, right?
Right. So what I
Mhm.
like hearing about what you're saying is, after a few sessions of the brain spotting, the woman could think of this thing and not have this physiological response. And I want you to think about that, because if you could think about something that currently brings you to your knees,
Mhm.
and you could then think about it and have a neutral response in your body.
Mhm.
That's everything. This is feeling safe inside your own system.
Yes.
That's that is a very deep form of healing, trauma recovery, trauma processing. It's
Mhm.
we don't want to be stuck.
No.
And the
But being
stuckness,
stuck is safety also because it's familiar. And so people will be stuck. I'll be stuck on certain things over and over and over again, but it's just because my nervous system wasn't ready or didn't feel safe enough to heal that layer.
can
And
you describe that? Because I understand that, but
Mhm.
this really kind of gets into the let them theory, because I've now moderated this book 5 times, and I've always started with saying, who here in the room read this book and felt worse about themselves, because everybody can let them but you can't. And
Right.
a bunch of people would always raise their hand, and I would say, tell me what's going on in and around your body when
Mhm.
you think about letting them or giving up control. And everybody describes this neck to gut situation.
Mhm.
And it is hardwired in our nervous system
Mhm.
to control for a lot of people, if that was their coping response, right?
Yes. Yes. And also, so much of our behavior is subconscious. And what I mean by that is we again kind of go through the motions and we have these cycles that we go through because it worked for us and XYZ and it got us through childhood, through adolescence and whatnot. And what we do in our work, you and I, is try to bring the subconscious behavior through us noticing and politely, pointing out into consciousness because you cannot fix or change something unless you are aware of it. So, I wanted to touch back on something that you had said about doing all of this therapy and how you were right thinking, you didn't have a lot of the racing thoughts. I did have a lot of racing thoughts, but that you were making progress, but you still didn't feel better because I had that experience with, I had gone through 2 therapists that were really exceptional and helped me in through different stages of my life that I really were purposeful and that I needed them for. And I didn't see a therapist until I was 25. And I don't know how that was, growing up the way that I did, that it took me that long, but that's what, that was just my journey. And I remember saying to my second therapist, Dr. Doug, that I could understand all of my behaviors. I knew why I was doing the things that I was doing. I knew what it was essentially like protecting me from. I knew why it was cyclical. I knew that it wasn't helpful, but I was thinking better, right? I could understand there was a lot of awareness there, but I wasn't feeling better. All
That
of
was
that stuff
me.
that heaviness in my throat, and it almost felt like this rod in my chest, was the first sensations that I had felt in tune with when I started this work. And I circle back around to that because I don't want people to feel like what they're doing is not purposeful. There was a time and place for talk therapy for me. There was a time and place for cognitive behavioral therapy. There was a time and place for understanding my codependency from a cognitive and intellectual space, because again, so much of our behavior is subconscious. And until you start putting language, which takes us back to the diagnostic stuff, until you start putting language to something, people just think that what they're experiencing is they're just meant to suffer, or that this is just the way they are. And that is so not true. We are highly, highly conditioned and adaptive beings. And how brain spotting and finding this work has helped me to bridge the gap is that I'm not just thinking and noticing that I'm stuck. I'm actually getting unstuck. And there's no way of talking yourself out of something. I love mantras or something that I also use, but there is not a mantra in the fucking world that is going to help you break out of a trauma response that is working for you to keep you safe. And if we could all wake up in the morning and say, I just don't want to be depressed, I don't want to have grief, I want to be, productive, I want to process my emotion, then we would just do it. And you and I wouldn't have jobs. So there's a piece of this front part of the brain where all of our language is that is helpful to start to deconstruct some cognitive distortions. Because we are highly intellectual beings, it's safer to be in our brain because that's what
Mm,
society wants from us. Because if we're in our brain thinking all the time and thinking our way through life, we're not connected to our body and realizing how shitty a 50-hour work week feels, or how shitty when your friend takes advantage of your boundaries. Like, when we don't notice those things, we just keep going. And so sometimes I say with brain spotting, what happens is it not necessarily you'll feel worse before you feel better. You are just going to be very much more aware, because we are putting the Barbie doll head back on the doll in a way that I don't think that words can even explain, having been through several brain spotting sessions myself, and then also having done this right on the opposite end as a practitioner. So there's a thing about letting them and trusting the process, in that the greatest example I can give is I feel really truly in the work that I do, and what I've noticed is the nervous system is a hierarchy, in that it's going to allow you to almost like shave some cream off of the top of the things that it feels the safest to go to. And if that is, I'm having panic every time I go to drive my car, and that's what I start with in brain spotting, then we will start with that. And there's going to be stuff just like, that's the tip of the iceberg. Brain spotting helps us to kind of chip away at the things that are under the water that are also contributing to that. And that could be memories from childhood. It could be things that had happened to you. It could have been times that you felt like you didn't have control. It could have been a previous accident, something that your body, right? Because the body keeps
yeah.
this, is reliving. So with brain spotting, it's going to allow us to almost chip away the things that your nervous system feels safe to go to. And in that, eventually we're going to get to deeper and deeper layers and more painful stuff. And that's where the attunement and trust with your provider is the utmost
Mhm.
importance, because your nervous system will only allow you to heal in safe spaces. And so for my own personal journey, I have brain spot tons of different things, tons of body ailments, dreams, like repetitive, vivid nightmares that I have, reactions that I have to certain family members or people in my life, my narcissistic abuse, I've brain spot several times. And a lot of my processing takes me back into my childhood bedroom. And I will get frustrated in the process and go, oh my God, like, what the fuck? Why am I back here again? I've done so much work around this. Like, why am I back here? But that is where the foundation of that was laid. And there is another layer there that now my body feels safe to go to.
Yes. And I want to describe a little bit some of the experience I had with the brain spotting. And one of the questions I have, because I've never asked you, is, when you're gazing at a particular spot. So I'll give you guys an example, the listeners, the example. When I start working with Jess, right? So she's the person that I've been doing brain spotting with. She's my practitioner. Um, you know, you'll start asking me something and I'll start just looking into a corner or
Mm-hmm.
looking around somewhere, and you'll ask me to just fix my gaze there.
Mm-hmm.
And this happened in our last session. I said, "Oh my God, my eyes are just getting so tired. Like I'm struggling to keep my eyes open." And you're like, "Well, then if you need to close your eyes, close your eyes." But what I felt, and I'm curious about this, is it almost felt like I was going into a deep trance
Mm-hmm.
just by staring at that spot. Now, when
Mm-hmm.
I induce my clients into hypnosis, I have them stare at a spot, right? And the spot that I have them stare at is right in between their eyebrows. So I have them roll their eyes up and have them
Mm-hmm.
look here. And then I
Mm-hmm.
have a way that I can induce them down. It's like a rapid induction. But I'm wondering if when we're gazing and we're focusing on a spot, and we're not really removing our gaze from there.
Mm-hmm.
What I'm trying to do when I'm doing hypnosis with my clients is get them into this theta brainwave state.
Mm-hmm.
When I'm staring at that spot and I'm doing brain spotting with you, is it fair to say that my brain is starting to shift into a theta brainwave state at that time?
That's a really good question. And I can only speak from, again, my personal experience of feeling like I'm in the in between. That's what I call it. I'm in the in
Yeah,
between.
that's a perfect way to describe it.
And I know that I get there. Do all of my clients get there? I don't know because I'm not in their body. And if I have an agenda for them that I need them to get there, then their session becomes about me.
Yeah,
And
no, right.
and that's why brain spotting, we have no agenda. And when we are talking about the let them, and it's really hard to watch people go back to old patterns, is that the old pattern is the safe, it's the strongest pathway. And so even if we brain spot it, there are things that I brain spot, like I said, tons of times, but I might go back to that old pattern of dissociating because that is a really strong adaptation for me. And I cannot push somebody's nervous system faster than what it is willing to go, not what they're willing to go. Because there might be someone that comes to me and I know that they had childhood sexual trauma, but the brain spotting session doesn't even touch that trauma until sometimes, and this is a legitimate example, 2 years down the road in a random brain spotting about something completely different that then goes back
Mm.
to that experience for them. And it's about trusting the process and, as providers, not pathologizing when someone goes back into patterns. So when I'm noticing, right? When I watch you and we're talking about whatever you want to work on, all I'm doing is noticing because your body reflexes, our bodies reflex past the thinking brain. And what I mean by that is when you're talking about something, there are going to be throat clearing, or you might notice, right, that your heart's more fluttery, or you're going to be blinking a lot or looking in a certain area, or your stomach is going to gurgle. And these are all signs. And I know that it's hard for some people's thinking brains to get around that because they're like, well, no, my stomach gurgled there because I didn't eat lunch. Nah, sis, your stomach is signaling to us. There is something about when we cross the visual field that spot, it's signaling healing is here, right?
Mm.
Trust your gut, literally and figuratively. Trust your intuition. Trust your body because our bodies are always trying really hard to direct us towards healing, and we just don't know
We
how to
fight
listen.
it. I think sometimes we fight it too. And it's funny because I've not heard this from just you. I've heard this from other practitioners as well. And of course, I never knew this was an adaptation
Mhm,
ever. But,
mhm.
I've heard you say to me, like, you're intellectualizing,
Yeah, that's a part
right?
for you. right? And some people, brain spotting really is a lot of not talking. And when you're talking, asking if you get into this theta wave, I do think that there are people that really lean into it and feel safe to do it, and they get into a trance. That's how I feel. There are times when people come out of session and I will, like, sometimes I will just write down little words because I'm hearing the full story, but it's about you coming to the full story. And it's so incredible when you watch someone process and the deep intuitive way that our body knows exactly what to do to heal. So I try not to interject verbally as as much as I can. But for people who want to go up to the brain, right? Because it's safe and there's a part of you that I know likes to know things. So
Yeah.
I'll give you little nuggets because giving you little nuggets helps that part of you to start to feel safe in the environment. And then allows you to start to reconnect to the body. But it's always about coming back to the body and trusting the
But I
process.
want people to hear what you're saying. So there's a part of me, and people know that's a very intentional thing for me to say. There's a part
Yeah.
of me that is the hyper intellectualizer,
Mhm.
right? And in many ways, that got me seen or got me to be a part of or
Mhm.
allowed me to feel enough in the
Mhm.
company of certain people that
Mhm.
I felt I needed the validation and the importance to be seen, right? So I learned how to adapt and how to become that part. And in
Mhm.
many ways, I love that part of me because I'm a
Right.
voracious learner and I want to understand how and why and all these things. But I also respect and understand now that that was a big part of learning how to adapt to my environment growing up
Yep.
was to use that part of me. Right.
If we're thinking, we're not feeling. It's again right and left.
Amen. Or
And
we're making meaning out of,
absolutely, because
right?
that's the brain's job. The brain's job is to make sense of what you're experiencing and make sense of what's going on within you, right? And that
Which
is literally the role of is your nervous system is to keep you alive, not to keep you happy. And the front part of your brain's job is to have interpretation and discernment of what is going on within you and outside of you so
right.
that you can make sense, right, of what you're experiencing.
And think about it. A lot of people experience things that are nonsense, that don't
Yeah.
make sense,
Well,
that
narcissist is one of them. Cognitive dissonance through that, which is why,
totally.
right, rationalizing and intellectualizing have such an important place, but they're only part of the picture. And that's where, addressing cognitive distortions and CBT and things like that can be really, really
Yeah.
helpful to challenge what your brain is saying. But at the end of the day, we can only fix the areas of the brain that have language. And that's why talk therapy only works on one part of the brain. And people are left feeling like they're not achieving anything or that they're still stuck. It's because you're missing a whole other part of the picture that, to me, I feel, and now and all the work that I've done is so much more important than just fixing our thoughts. Again,
And
because you
I
could say mantras all day, every day, but if your body is stuck in a cycle and it's keeping you safe, it will keep doing it.
well, there's a couple of things. Number one, I want to point out that to your point earlier, it's the safe and sound situation where, you do give me the little pieces of data I'm seeking while I'm
Little
getting
nugget.
safe and secure, because
Mhm.
then I do go deep. And then I
Yes.
am able to let down that intellectual part, and that intellectual part can take a beat and it does get unburdened with having to feel that its job is to keep me safe. And
Right.
I do go to places I never anticipate going to.
Mhm.
And I do just, to your point earlier, I just shed another layer and another layer and
Yep.
another layer. And guys, it's a process. And, there's no quick fix here.
There's
It's
not.
the,
And
it's
if there was, we would have found it because
That's
of our
right.
crazy, chunky brains. We would have figured it out by now. And
And
we
I
just
think one of the things that I think I'd like to ask you about, what I wrote down here was implicit and explicit, right?
Mhm.
So we have different kinds of memory. We
Yes.
have explicit memory, which we can retrieve. We know
Mhm.
it. We understand it. It's
Yep.
conscious. It's
Yep.
it's something that we're aware of.
Right.
Implicit memory is something that we sense,
Yes.
but we don't necessarily have access to. We're aware of it in our body, but
Right.
we don't have an actual clear memory of it. Would you agree with that?
I do, and how I understand that concept and why that is to be is the difference between declarative and non-declarative memories. And so to try to simplify it, a declarative memory is a memory that you have when you're feeling more in that ventral vagal, that parasympathetic rest and digest state, when you're online, when you're feeling safe, grounded, connected, seen, heard, validated. You're calm in your body. So when you're calm in your body, you have access to the front part of your brain, which is where your language is stored. So if you look back at, a picture that you have in your phone of a really fun memory that you just had, and you can almost say, oh, I was wearing this, and this is what I was smelling, and this is what I was tasting, and that you have access to your sensory information too when you are forming declarative memories. When you are in a trauma response or you are oscillating in a trauma response, the front part of your brain completely shuts off.
Yep.
Like there is no like thinking, there's no logic, there's no rationalization. You are purely, your body is functioning on survival. So with that, then you lose access, right, to the language that you have, which is why memory, that's probably not a Freudian slip, but the non-declarative memories tend to come back then as triggers, sensations, fragmented memories, right? Or big emotions that you feel in your body that might not make sense because you don't have the language to
Right.
put to that memory.
Right.
And so that's how, when you're talking explicit, implicit, and I think declarative and
Yeah.
non-declarative, when I'm working with people and I'm trying to help them understand, and there is no population that I do this more with than people with ADHD, because the front part of their brain and where all of your
Offline.
executive functioning is, so many people will say, well, I don't even remember my childhood. And how trauma and ADHD and neurodiversity intersect is a whole other conversation and a million episodes that we could have. But it's not a bad thing that you're not remembering those things, but your body has a memory. We don't start developing language until what, like 2, 3 years old. And your body, the implicit memory, has a history of those, especially 0 to 3 years, when your nervous system is doing a lot of memory, or a lot of assessing safety in the environment, a lot of developing, a lot of figuring out where, if you're safe in the world, and picking up on cues and people's body language and body energies. So you have that 0 to 3 years that's really important, that's forming a lot of implicit memory. But then you also have the time that you were developing in your mother. And this is where generational trauma and things also play a role in the blueprint of how you function in the world. And it really is that much. Like people, I remember when I always joke that my brother used to tell me I think too much and there can't be that many layers, but it really is. Human beings are super, super complex creatures.
Yeah.
So to negate 0 to 3 years and then the 9 months that you spent in mom as your body was developing, and the implicit imprints that you have from
Mhm.
the things that you experienced, it's almost silly to not include that.
And then add in epigenetics.
Add in generational trauma, epigenetics, your childhood experiences, and everything else, and attachment to mom, attachment to dad, attachment to family members, any sort of, lack
Attachment to
thereof.
self.
Exactly. And it is this multi-layered, our lived experience is not, we're not meant to just be in functional freeze. And so when you really start doing this work, I don't want anyone to think that the things that they have done thus far have been for nothing. So people say, well,
Amen.
I've been in therapy for so many years. I've tried this, I've tried that. It didn't work, or it didn't impact me the same way that I see it impact other people. Well, it's just because all of our nervous systems, we could grow up in the same exact environment. Look at your siblings. My brother and
Yeah.
I grew up in the same exact environment, completely different protector parts, some similar. Him raging extreme ADHD, me barely, even if I'm on that spectrum, I'm on the lowest end, right? And so there's so much to be said for each individual experience, and really just trusting yourself that whatever you have done has been a step in the process, because
And
there's
I
always
agree
more.
with that because, I think I said this to you. It was either to you or someone else the other day. I think of all the therapy I've ever had,
Mhm.
the
Same.
most impactful one was the very first practitioner I had in the 80s. She was
Mhm.
young, and it was powerful and impactful because I felt safe
Yeah,
and I felt
exactly.
understood. And
Mhm.
because outside of those 4 walls with her, I felt crazy. I
Absolutely.
felt as though the lived experience I knew I was having, I was being told, "No, you
Right,
aren't, and
right.
you're just exaggerating, and it's
Or your
not as bad
body is
as you think
screaming
it
like,
is." But
"Danger, danger."
absolutely. So it
Yeah,
made me feel like I couldn't
yeah,
trust myself, or
yep.
that I couldn't entrust my interpretation of my experience. And to your
Mhm,
point, I am the oldest of 4. All of us
mhm,
process the situation differently.
mhm.
And then, she allowed me to feel safe, seen, heard, understood. And I remember saying things to her and saying, "I just feel like I don't know how to explain it, so you'll believe me." And she goes, "I do believe you."
Yeah,
And it was hard
that's
for me to even allow for that, okay?
mhm.
Because then I'd have to actually really start to accept, like, the things that
Yes.
I know to be I mean, that's, like, complicated, but,
Yeah. Well, denial is a beautiful protector
she
part too.
allowed me to learn how to attune and to share my
Yeah.
story and to get
Mhm,
into that vulnerable space. And I had another
mhm.
therapist in my 20s who, did total CBT with me, and it did help in many, many ways. I think for
Same.
me, that constancy of
Mhm,
activation in my
yeah,
vagus nerve and in my nervous system was
mhm.
just so debilitating that I
Yes.
thought that every single one of those therapists should have, and I put that in quotes,
Mhm,
should have been able to alleviate that for me.
mhm.
And that just wasn't the purpose of them in my journey. Right?
Exactly.
And then getting to the person I did go to, her name is Deb Lilly, she started me on that journey. And then a
Mhm,
lot of what I've done has happened since then. But,
mhm.
to your point, each one of us is on the journey that we're meant to be on.
Absolutely.
And we are experiencing the things that are divinely designed for us. And I know some people hate it when I say that, but I do believe that life is a series of experiences that are divinely designed for us
Yep.
individually, uniquely, for
Mhm.
whatever it is we are meant to gain in this lifetime. That is a very Buddhistly rooted philosophy, but I am very Buddhist at heart.
Yep. I'm very
Um,
much with you on that.
and
Mm,
so we can't fight what is. We get to say, okay, what's meant for me through this. We
mhm,
certainly are may or may not be that enlightened to be even ask that question when we're under the
mhm,
age of say 30.
mhm.
Um, but I do believe that, and you can disagree with it or not. It's just my personal point of view. And I believe that there is a gift in every single challenge, and there's something to be learned in every single challenge. And there is absolute purpose in all of the pain. And I've had a lot of it. So
Yep,
for me to be
and
able
that's
to
where
say it, and it's not a way
yeah,
for me to justify it. I've
no, but
learned so much about myself through these experiences.
right, post-traumatic growth is
A
real,
very
it
real thing.
and when you're in your post-traumatic growth stage, how I view it in similarity to yours is that now that the head is back on the body, I'm
Yeah.
paying attention to signs, to patterns in my own behavior, to patterns in my own experiences and how I feel about things, and I'm listening now because I can, because I'm not in fight or flight, because I'm not just fucking blowing through life. And are there phases where life gets so overwhelming, or there's a pain that happens or a loss that happens, it's so overwhelming that I do go back to those, trauma responses. Yeah, that's what they're there for. They're
That's
there
right.
to help me get through those moments, but then it's my job now to notice it, to slow it down, to integrate what I need to within me through brain spotting or other somatic work, to separate from my protector parts and thank them and be grateful for them
Right.
for always coming to my aid when they need it. But the hierarchy of my healing is when I pay attention to those signs, that's really your body giving you signals on where it feels safest to start to heal.
Yeah.
So if that's
And that
any piece of little advice and unsolicited advice that I can give to people as they're on this, we're all just leading each other home. Stacy and I are not experts at anything other than we're trying to be experts of ourselves to then help you be an expert of yourself,
yeah.
because that's where real healing happens. And I don't know any more about my clients than what they know about themselves. I am not the expert on them. And that's a very different idea or thought process when you're trained in Western medicine, that I have a lot of initials after my name and a ton of fucking student debt, that I somehow know better than the people across the screen. I don't know better than them. Their nervous system knows exactly what it needs to be doing. Their protectors know what they're doing. It's just my job to lightly encourage and to be curious, and also help my clients, including Stacy, to be curious about what why that part is showing up. Why does it feel unsafe to go there? If it feels too unsafe, then we don't go there. And that's how you start to build trust. Because I heard a podcast recently where they were talking about how important it's not even about the education that your provider has. That's not the important thing. That's not how work gets done. It's how safe you feel with them.
Yeah.
So
Yeah.
really just trust the signs, trust your body, even if it's screaming at you, even if your mind doesn't seem like it's making sense, there's a reason for that.
Mm.
And, get back to whatever, I don't care what form of healing people do or what mindset, that spiritual thing that they need to feel like it's not all on them, but it's like we blame ourselves for so much in life.
Mm.
And a lot of it is just our programming. It's just our
It is,
conditioning.
it's our conditioning, and
Yeah.
I think to your point, I think anyone that loves what we do, and we do similar things but from different angles,
Absolutely. Mhm.
or I always just say my ultimate goal is just to hold safe space for someone so they
Yep,
can allow a defensive layer
yep,
to go down a little bit and get curious,
yep.
because the more aware the person is about their own lived experience and about how it's still represented inside their body and the imprint it
Mhm,
has continued to leave inside the body, and then how do we look at that imprint and investigate that imprint and change
mhm.
the imprint in the way that is best for the client. That's all we're doing.
Yep,
We're just listening. We're listening for the clues. To your point, we're watching, we're observing, and we're just asking them questions to get inquisitive about themselves. And I think, to your point, there's always going to be, even those of us who do the practice and know the practice and are in our post traumatic growth era,
mhm.
um, we are going to have big, heavy processing emotions that we have to go through. And, you know, uh, you and we didn't have a break for
Mm,
15, 20 years. There was no reprieve, right? So
mhm,
that frequency was constant, the intensity was constant, the duration was everlasting.
mhm.
And so, what I always say to my clients is, the goal here is not to never feel anxiousness or to never
No,
have
no,
a situation inside
yeah.
our nervous system. But the ideal outcome could be less frequency,
Yes,
less intensity,
yes,
less duration.
exactly.
And
Yep.
that's all we're looking for. It's how am I keyed in enough to my own body by way of what I've learned from
Mhm,
Jess, Kira,
mhm.
Stacy, whoever it is, that I can gain the awareness, communicate with what's going on with myself, and
Yeah,
then decrease that intensity in that moment and decrease how long it lasts.
yeah,
Right? That's
yeah.
really the goal,
That's
and brain spotting is a tool. Like
yes,
my
it is.
RTT is a tool, like
Exactly.
parts work is a tool, like
Yep,
polyvagal theory is a tool. We just
yep,
keep getting, more tools inside our toolkit in
yep,
order to pull out when we can see it with our clients, and then give them enough understanding about it for themselves that they can then use the tool. I mean, that's
exactly.
what we're talking about at the end of the day.
Yep, and you have to find what works for you, because there are certain things that you'll do that don't resonate for me, or they might not yet because I'm not there. Things that
Yeah.
I do that don't resonate for you, and this is why it's good to have variety,
Listen,
or it's
there are
good
some
to
clients that, we can do light hypnosis session 1, 2, or 3. There are some
Mhm.
clients I've been with for a year. We've never
Mhm.
even tapped into it
Yeah,
because their parts aren't ready and they're
exactly.
not comfortable enough. They're still in I need to share my story
Yep.
zone. And that's a
Mhm.
part of the processing. And we talk about how that feels in and around the body when they're doing that. We started to get curious about the parts that are present. But I
Mhm.
know, and some clients say to me when I just like ask them if they're comfortable with just closing their eyes for a second, they're like,
Mhm.
how do you know when to do that? I'm like, it's an intuition. I'm
Yes,
sensing,
if you're attuned to them.
yeah, I'm sensing this could be a good place to go right now. And I
Mhm.
could be wrong,
Right.
but
Yeah, sometimes we are, right? Sometimes
but
we
the
might
reality
push
is,
the nervous system wants to go, and then we sense the shutdown, or we sense
and
the
I have one client where we did that once, and after 10 minutes, she said, This part of me is done now." I said, "Great, then
yeah,
let's be done. You're in control, not me." But she
yeah.
loved it. And then she said, "Can we do
Mhm.
that again?" And I said, "When I know, I'll know when it presents itself." And
Yeah,
now she just eases into
leans
it, where before this
leans
was
into it.
scary, so we play
Yeah.
with our tools. So you're amazing. I love
Oh,
you. I have
amazing.
loved having this conversation. We were like geeking out when
Yeah, I
we
hope it
were
makes
like
sense.
in the
We're a
green
little
room. We were like,
yeah,
oh, we both have our jean jackets on for this.
yeah, a
We're
little
not,
all over the place, but hopefully enough that it makes sense
it's
because it's
not all
all
over the place.
connected.
I'll
Yeah.
tell you this. You were like probably episode like 138. Like I've done
Mm,
almost 140 episodes,
mhm.
right? So sometimes I'll think it's disjointed and all over the place, and then I'll re-listen to it. I was like,
It's
"That's
very
fat. Like that was
yeah, really
good."
good. Yeah,
You
damn.
know? Like
I
that
love doing
actually
that.
all
Yeah,
tied together.
good. Yeah.
Um so I think
That's
we'll be okay. I think we'll be
yeah.
okay. So guys, here's the thing. If you're curious about brain spotting, you definitely want to check out Jess's website and anything that has to do with Jess. You want to check her out. Her company is called It Ends With You, and her website is itendwithyoullc.com, and it's Jessica Parente. It's Parente. um, if somebody wants to get in touch with you, is the website the best place to go?
Yeah, website contact form. Also, you can follow me on Instagram and slip into my DMs. I'm fine with that too. And it's my personal page, so you'll get a lot of cat pictures and concerts. So enjoy. That is
All
me in a
right.
nutshell.
Well, this has been a pleasure. We could jam out
Yes,
all day.
yes.
Guys, again, it's Jessica Parente. We were talking about brain spotting. We're talking about what happens inside the body, that the body keeps the score. This is all just continuation of the same message I've been giving you for 3, 4 years of you're not broken. Your
No, you're
body
not.
is just still adapting when maybe it doesn't need to be adapting anymore. And it's still in survival mode when it doesn't need to be in survival mode anymore. And there are so many different tools, brain spotting being one of them, that can help you each tool is different for the different person, that can help you connect with your body, get that Barbie head back on the body in a comfortable, safe, sound way where your body wants to be connected,
Right.
right? And where
Mhm.
is ready to experience it because someone's holding the appropriate space in the appropriate way for you, individualized, personalized, so you can actually have a long, fulfilled life. That's the ultimate end goal.
Regulated and integrated. That's
That's
what
right.
we
I
want.
love it. Jessica, thank you so much for coming on the podcast today. Your journey is a testament to the power of healing, self discovery, and simply creating meaningful change. We're so appreciative for you coming on and sharing your story, for the incredible work you're doing to help with others. For those who want to connect with Jess and to learn more, visit her website. It is itendswithyoullc.com. I'll say that again. Itendswithyoullc.com. And if this episode resonated with you, please, please, please subscribe, leave a review, leave a comment, share it with someone who needs to hear this message. Until next time, remember, healing starts with understanding your story and taking the next step forward.